The process of childbirth can be divided into 3 stages. That are cervical dilation, expulsion of the newborn, and placental stage, or afterbirth. The first stage is the dilation of the cervix. Well, this is the illustration of pre-labor stage. This is the cervix. That has not dilated yet. Here, you can see the amniotic membrane. And this is uterus. As for vaginal birth to occur, the cervix must dilate fully, like this, about 10 centimeters in diameter, so that it's wide enough to deliver the newborn's head. It is the longest of the stages of labor, but duration varies widely, from minutes and hours to even days, depending on whether the mother has given birth before or not. If the woman is giving birth for the first time, who is referred to as a primipara, then it usually lasts for about 6 to 18 hours. While for the women who have previously given birth, means a multipara. Then, this stage of labor is shorter in duration, and tends to be shorter with each subsequent labor. Now, there are 2 main features of this stage. One of them is cervical effacement. That is actually the progressive thinning of the cervical wall, while the other one is cervical dilation. That is, of course, the progressive widening of the cervix. Well, this stage begins with the onset of true labor. Fetus begins to move downwards due to gravity and uterine contractions. In normal position, fetus head is forced against the cervix. As you can see here, this stimulates even stronger labor contractions, which stretch the cervix. Cervical stretching induces reflexive uterine contractions that dilate and efface the cervix further. Thus, you can say that the true labor progresses in a positive feedback loop. In addition, cervical dilation boosts oxytocin secretion from the pituitary, which in turn triggers more powerful uterine contractions. When labor begins, uterine contractions may occur only every 3 to 30 minutes and last only 20 to 40 seconds. However, by the end of this stage, contractions may occur as frequently as every 1.5 to 2 minutes and last for a full minute. Each contraction sharply reduces oxygenated blood flow to the fetus. For this reason, it is critical that a period of relaxation occur after each contraction. Fetal distress, measured as a sustained decrease or increase in the fetal heart rate, can result from severe contractions that are too powerful or lengthy for oxygenated blood to be restored to the fetus. Such a situation can be cause for an emergency birth with vacuum, forceps, or surgically by caesarean section. The amniotic membranes rupture before the onset of labor in about 12% of women, releasing the amniotic fluid. It is also known as water breaking. They typically rupture at the end of the dilation stage, in response to excessive pressure from the fetal head entering the birth canal. If this ever happens before the dilation of cervix, then there is a risk of infection. So, labor is induced in such case. When cervix is fully dilated, next stage starts. That is the expulsion stage. Watch the very next part for that.
Explore our extensive library of over 1,800 video lectures. to learn about a wide range of topics. Only on sqadia.com.